Good afternoon. My name is Marla McGuinness, and I will be your moderator for today's news conference. Before we begin, I'd like to introduce the Honourable Iain Rankin, Premier of the Province of Nova Scotia, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Marla. Some sad news today in our province. We have two deaths to report. Two men in their 60s, both from Central Zone, and both died in hospital from COVID complications. Our thoughts and prayers go out to the families and friends on behalf of all Nova Scotians. We are reporting 17 cases today, the majority, 11 of them in the Central Zone. And the case count in our province is up a little bit from yesterday, but certainly not a spike. It's manageable, and that's why today was the first day of our opening up plan. Schools are starting to reopen, restaurant decks are serving lunch today, and people can start to play more sports and exercise outside. For many of you, our phased approach is too slow and not specific enough. I've heard you, and I understand that this is hard. But let me remind you that only a month ago, we went from having a couple of cases down up to triple digits. And 3 short weeks ago, we had a spike of more than 200 cases. The virus came in from outside carrying the variants, and it spread quickly. We don't want to go back there. You worked really hard to get us where we are today, and it would be irresponsible for us to just choose an arbitrary date to open up without quarantine. So we're taking a slow and steady approach. I understand you want some clarity and certainty, but with COVID, nothing is for sure. That's why we're approaching our reopening plan in phases. And those phases come in 2-week increments, considering the data all along, our cases, our positivity rates, our epidemiology, and our vaccine uptake, hospitalizations, the number of people we have in ICUs, and the advice from public health of what's happening on the ground. We are in phase 1 now, and we are opening our economy slowly. Within this phase, we're allowing more people to come into our province for end-of-life visits and funerals. We're allowing summer students to enter with quarantine, and we will be piloting testing at the airport in preparation for the launch June 14th. Phase 2 should happen by June 16th. Restaurants and gyms will move indoors. Seasonal property owners can move back, and if you're moving to Nova Scotia, we're happy to welcome you in this phase. If everything continues to go well and we're able to contain the virus, we will move into phase 3 by around June 30th. We'll be able to listen to live music inside, and we've clarified that outside you're permitted to have one musician playing outside around patios for phase 1. Gym and retail will open up even more in phase 3. And it's in this phase that we'll start to allow residents from the Atlantic region to come and go into our province. So those who want to travel into Halifax or move out of the province in and around the Atlantic region can start to look at the June 30th date. And those coming in from other provinces can start to look at that date, but will have quarantine requirements. Let me talk about that 14-day quarantine policy. I know it's hard to isolate away from family and friends when you come into our province from somewhere else. That has been a consistent policy, but the vaccine has been a game changer, no question about it. While we enter in and out of phases, I want you to know we're working on a proof of vaccine strategy. This work is being done at the national table, but we are doing our own planning as well. Starting out with rotational workers who are moving in and out of our province frequently, even they've been vaccinated, they'll still have to quarantine. We agree this doesn't make sense. So we're urgently working on a system that will provide those workers proof they've been vaccinated for 2 doses. Once they can show that evidence with a credible system, they won't have to quarantine. The same will eventually apply to anyone coming in from out of province for a visit or a vacation. And for those who want to enter but still have only 1 shot, they may still have to isolate for 7 days, providing they've tested negative in that week. And this is all happening in around the next month, during our first 3 phases. As we get into phase 4, by July 14th, and if our cases continue to remain low and our hospitalizations are down, we have all of our first doses out and are moving quickly to our second dose program, and with the proof of vaccine program, we should be in a position to welcome all visitors and tourists from across Canada. For those that do not have proof of vaccine or only have simply one dose, there will be some quarantine requirements, but our economy should be open by then. And I know Nova Scotians can do the work to be able to get us there, but I need you to continue to give us flexibility, Dr. Strang and I, to monitor the conditions all the way through those 4 phases. Before I hand it over to you, Dr. Strang, I wanted to let you know this morning I talked to Dr. Kevin Walsh, our Nova Scotian who climbed to the top of the world, reaching the summit of Mount Everest on May 23rd. When I spoke to him, he's getting back to Canada later today, and of course we spoke about the climb and how proud he was to plant the Nova Scotia flag on the summit. I congratulated him on behalf of all Nova Scotians. What a great feat. But you can't have a conversation with anyone these days without talking about COVID. And Dr. Walsh has been following our plan and our numbers from Nepal. And so Dr. Strang, Dr. Walsh wanted me to say hi to you. You two worked together on the oral health COVID response, and he told me that you were awesome, quote, awesome. And I agree, despite the fact you're a Habs fan. Congratulations to your Habs for winning Game 7. So a shout out from Dr. Walsh, and I'll turn it over to you, Dr. Strang.
Thanks very much, Premier, and it's nice to be recognized by somebody who's as courageous as Dr. Walsh climbing Everest. And you were telling me about getting a Lafleur jersey, so I'm looking forward to you wearing that Lafleur jersey at some point, Premier. Anyway, good afternoon, everybody. And as the Premier said, we are unfortunately reporting 2 more deaths today. Despite declining cases, the third wave continues to have tragic impacts. Families are still losing loved ones, and my heart and my condolences and sympathies go out to them. We should expect to see moderate case numbers for the next several weeks. The good news is that we're not seeing any sign of substantive community spread. The percentage of positive cases from the amount of testing we're doing continues to be very low and getting lower. But we know this is how the virus works. Things can change quickly. So we need to follow restrictions, get tested, and get vaccinated in the weeks ahead. Testing is critically important because it helps us know how much virus is circulating. Early in Wave 3, there was likely a lot more virus in the community before we fully realized the extent of what we were facing. With Phase 1 of our reopen plan in effect today, people are returning to work and school and some recreational activities. Be sure to make regular testing part of your reopening plan. And the more you're out and about and the more contacts you have, the more frequently you should get tested. Right now our situation looks positive, and I anticipate we will be able to move to Phase 2 on June 16th if we all keep doing what is needed. Some people want more certainty and some want us to reopen faster, but there is no certainty with COVID-19. In mid-March, when we opened the border to New Brunswick and lifted remaining restrictions, we were in a safe place. Yet a month later, Nova Scotia, we would face the worst this pandemic has thrown at us yet. Our current slow and steady approach will ensure that once we're open, we stay open. And that's what we all want. Our vaccination rates continue to climb. High vaccine uptake will greatly reduce the chance of severe impacts from the virus and another surge in cases. But until 75% of all Nova Scotians are protected from vaccine, the full protection requires 2 doses, the vaccine alone cannot protect us. And that's why we will have to have some restrictions throughout the summer. As of today, almost 57% of Nova Scotians have had 1 or more doses of vaccine. So thank you to all Nova Scotians, and I know many more have already had their appointment and are waiting to get vaccinated. But we need 85% of all eligible age groups to get vaccinated with both first and second doses, and that's what will get us to the overall 75% population immunity. Today, we announced our first case of VIT, or vaccine-induced thrombocytopenia, in a male in his 50s. He became symptomatic a couple of weeks after getting his first dose of AstraZeneca vaccine. He has been treated and is thankfully recovering. And as we know, the AstraZeneca vaccine does come with a risk of this rare but serious blood clotting condition. We have a process in place, like other provinces, to monitor and report adverse events related to all vaccines. And so anyone who experiences a serious or unusual adverse event from a COVID vaccine or any other vaccine should report it to their healthcare provider or seek immediate medical attention if they deem that necessary. Announcing our first case of VIT comes on the heels of yesterday's news that Nova Scotia is resuming the use of AstraZeneca for second doses. The National Advisory Committee on Immunization updated its guidance on the interchangeability of COVID vaccines yesterday. The recommendations will give us much more flexibility with our vaccine program, and it will be based on choice and informed consent. Those who got a first dose with Pfizer or Moderna can choose either vaccine for their second dose based on availability or preference. The two mRNA vaccines are completely interchangeable. But given that our Moderna supply is uncertain and is going to be much less than the Pfizer vaccine, it is likely that you will be able to book a Pfizer vaccine before you will be able to book a Moderna vaccine. And at some point, we may not have Moderna as a choice. But it's perfectly fine to choose Pfizer if you've had Moderna for your first dose. We want you to choose the first mRNA vaccine that is available so that you are fully protected as soon as possible. And for those who got a first dose of AstraZeneca vaccine, they'll be able to receive a second dose of AstraZeneca, Moderna, or Pfizer vaccine. For those who choose AstraZeneca as a second dose, there are two things that you should know. The first is that real-world evidence is telling us that this vaccine is not as effective after first or second dose as the Moderna or Pfizer vaccines. There is some difference in effectiveness. And the second is that there is still a risk of VIT even with a second dose. Right now, the VIT cases are presenting at about 1 in every 600,000 people who get the AstraZeneca vaccine as a second dose. So if you've had AstraZeneca and you choose Pfizer or Moderna as a second dose, we also know that mixing of vaccines that you can lead to a slight increase in minor side effects that are short-lived, like fatigue, fever, or pain at the injection site. So we will make sure that Nova Scotians have all this information that they need to make their choice as part of an informed consent process that goes along with getting any vaccine. On Monday, with this last Monday, we said we were close to inviting the first group of Nova Scotians to move up their second dose appointments. We are still working through a few technical issues that have arisen, but invites to move up your first, for the first people who were first in line for first dose, their invites to move up their appointment for second dose will be coming very soon. And those initial invites will include those who had a first dose between March 11th and 21st, and are due for their second dose now with their appointment between June 21st and July 3rd. Those who received a first dose of AstraZeneca will also receive an email notice to reschedule your second dose appointment beginning early next week. And that initial email out will be for anyone who had their first dose of AstraZeneca March 11th to 27th and currently would have a second dose booked between June 24th and July 10th. The province has about 2,000 doses of AstraZeneca set to expire by the end of June. If that is used and there is ongoing demand for this vaccine, we can and will ask the federal government for more. Today marks the first official day of our reopening. People can start to move around the province, see family and friends outdoors, return to school, and enjoy a meal on a patio in our beautiful weather. We are moving into a new stage of our pandemic response, and we have a reason to be more hopeful that we will enjoy most of our summer together. Population immunity is coming. Fewer restrictions are coming. Freer movement across our borders is coming, but we are not there yet. And until we are, I will continue to advise caution and encourage you to follow the restrictions that are in place at the time. Get tested and get vaccinated. Going too fast, especially in opening our borders when one dose of vaccine does not offer good protection from at least one of the variants, is inviting a fourth wave and a return of restrictions. Being the tortoise among hares in this race to the new normal is good for our collective health and our long-term economic success.
We will now take one question and one follow-up from media in the amount of time that we have. We will begin with Shayna Luck, CBC. Go ahead, Shayna.
Hello. Premier, you talked about setting up some kind of system for people who are entering the province to prove they have 2 doses. I'd like to understand more about that. Why is it not sufficient for people to show the proofs of vaccination they've been given by their home province?
So we have to make sure that we have a credible system in place. We have to prevent fraud, for example. If someone has been able to show or fabricate an email that says they're a vaccine, we just need to be cautious about that. People were less than honest, and that's what caused the third wave. We've had people in our province not adhering to our quarantine requirements in the past. So I'm not prepared to open a border until we have a system in place that shows that they have proof of vaccine. And we're careful about how many shots because of the Indian variant, namely, but there's other variants of concern, and we need to make sure that we're protecting Nova Scotians.
I think I'll add a couple of points to that. There are ongoing national conversations among information technology folks setting exact standards to this point, that what actually would constitute sufficient proof of an electronic proof of vaccination because of all the security and the privacy issues. I was just reading an email this morning about reports from the Europe of substantive concerns around fraudulent claims of proof of vaccine. So we need to behave cautious in this, and we are participating in these national conversations on the technology side.
Shayna, do you have a follow-up question?
I do, and I'm not sure whether it's for the Premier or Dr. Strang or maybe both. But Newfoundland announced today it's going to allow fully vaccinated Canadian travelers without any testing or isolation requirements as soon as Canada Day, possibly. And some of those people will probably try to drive through Nova Scotia. How do we deal with that?
Well, I did speak to, I can start, I spoke to the Premier of Newfoundland yesterday. We're in constant contact with our fellow Atlantic premiers, and to be honest, we had a different situation. We're just finishing our third wave, so it is challenging to have full alignment with all provinces in the Atlantic region. So they're going to move ahead on July 1st. We're not prepared to make that decision yet. Our Phase 4 looks at that contemplation, and by July 14th, if all goes well, we'll continue to have those discussions, but we need to make sure we're protecting Nova Scotians, and that 2-dose makes sense. If you have both doses, you can prove both doses, but that's the whole idea of looking at this program that we're trying to put in place so that we have a credible program, but we're in constant contact with our neighboring provinces, and we're mindful of what they're doing too.
Next we'll go to Natasha Pace, CTV. Go ahead, Natasha.
Thank you. I just wanted to clarify first, Dr. Strang, I believe you said the gentleman who had the blood clot was in his 50s. The release says a gentleman in his 40s. Can you say which one is correct?
No, I believe I said the 40s. If I didn't, I apologize. It is a gentleman in his 40s.
Natasha, do you have a follow-up?
I do, yes. The Premier, I know on Monday or on Friday rather, when you released the phase reopening, there were no dates attached to the plan. Today, obviously, you are saying some targeted dates for when we could potentially move to different phases. Is the reason you're addressing that today because of the pressure put on by businesses to allow them to be able to plan accordingly?
So there's no change in our plan. We said that there will be phases from 2 to 4 weeks, so we're doing the math for people so they can clearly see what those dates are. I understand that they want to see the dates. They want to see some certainty, not just businesses, but people that want to book some travel. I do have confidence based on the last couple of days that our numbers will continue to stay down as long as Nova Scotians listen. It's really important that we listen to the current restrictions in place, or we won't achieve those dates. What I won't do is put hard dates out there and commit to them. Dr. Strang and I feel that we need the flexibility. We've given public health flexibility to continue to monitor our own epidemiology and what's happening across different provinces, especially our border provinces. So that's what we're going to continue to do.
Next, we'll go to Alicia Drost with Global. Go ahead, Alicia.
Thanks. I just wanted to follow up on an earlier question, just with Newfoundland announcing that they'll be opening potentially to all Canadians on July 1st. And I know that New Brunswick has kind of said similar things. I'm just wondering what this means, though, if we're open to the Atlantic bubble and the Atlantic bubble is open to Canada. Like, what does that mean in terms of if someone, say, from Ontario goes to New Brunswick for 2 weeks and then, comes into Nova Scotia? Like, how does that work?
Yeah, it's challenging, and I'm not calling it a bubble anymore. What we're looking at is a phased-in approach to allowing for Atlantic Canadians to start to look at potentially coming into our province, and that's a big reason why we need to be flexible and monitor the situation with their provinces, what kind of border protection that they have, what kind of testing strategy they have because Newfoundland came out with their plan today that requires some testing if you have 1 dose of vaccine. So all of those things need to be considered when we're looking at further opening up travel into our province.
Alicia, do you have a follow-up question?
I do. With NACI saying that mixing and vaccines is okay, specifically for those who have received their first dose of AstraZeneca, and Dr. Strang, I know that you said that as of yesterday, we're now offering AstraZeneca again for second doses. What would you tell Nova Scotians who had their first dose of AstraZeneca how they can make an informed decision on whether or not to get AstraZeneca for the second dose or an mRNA vaccine? I've heard from people saying, we're not doctors, we're just not quite sure what to do, how to make the best decision moving forward.
So we're going to provide them with information on our website. They'll also have information on the consent document that they sign. As I said in my remarks, outlining the differences between the two types of mRNA and the viral vector vaccines, and they'll be able to get either vaccine at about the same time. So ultimately, they're going to have to make some decisions about their understanding of the information about the difference in effectiveness, the rare but potentially serious side effect that can come with the AstraZeneca vaccine, the information about a slightly increased risk of non-serious short-term side effects from if they mix vaccines, and they're going to have to make their choice about which vaccine that they want to have. We don't ultimately, people do have to look at that information and make a choice for themselves.
Next, we'll go to Keith Doucette with the Canadian Press. Go ahead, Keith.
Thank you. Good afternoon, Premier. New Brunswick yesterday said they were going to extend their travel incentive program to the rest of the Atlantic region, to people going into New Brunswick for the tourist season this summer. I think it provides something like a 20% rebate on eligible expenses up to $1,000. Are we looking at anything similar to try to encourage people to, once we open up, come back to Nova Scotia?
We'll work with our businesses, and we'll look at differing marketing campaigns, how we continue to try to showcase the product that we have here, that I'm very confident we will continue to exceed our tourism targets once we get back to some level of normalcy. And I think people are excited to start looking at how they can travel into our province. We're not considering any direct incentive to people. After we opened up with previous waves, we saw significant business occurring in our regions, but we will be a partner with our tourism sector, and I'll continue to meet with the associations on how we can best be a partner.
Keith, do you have a follow-up question?
Yeah, it's for Dr. Strang. New Brunswick today has been put a real push on to get to 75% of those eligible for a vaccine by Monday. They've set a target for a partial reopening there, and that's what they're trying to get. But their message today was that they're lagging a little bit, and they're trying to get people to get out there and get some excess shots taken up. We're trying to get, 75% of the population. How would you characterize where we are at this point? Was there an initial surge, and now it's kind of leveled out? And do we need to pick up the pace? Where are we with vaccinations in real terms?
We are still our target. You're right. Our target is 75% of the entire population, which means 85% of those who are eligible. At the beginning of the week, we're about just over 50%, and now we're getting close to 60% of those who are eligible getting their vaccine. So we're rapidly increasing. We are seeing no decline. All the vaccine we have is getting pushed out through our community clinics and our pharmacy physician clinics, and all our appointments are getting filled. So there's no lag in our vaccination, and now we're down to I think it's the age groups that are 40 and above have over 80%, at least a minimum of 80%, some well over 90% uptake in those age groups 40 and above, and the younger age groups are filling up the appointments as they become available. So there's nothing at all that would suggest anything other than Nova Scotians are answering the call to come out and get vaccinated.
And just to add to that, right now we have 71% of Nova Scotians that have either received their first dose or are actually booked for one. So we're doing well.
Next, we'll go to John McPhee with the Chronicle Herald. Go ahead, John.
Thank you. Yeah, this is for Dr. Strang. Just getting back to the AstraZeneca situation, given the blood clot risks, even if they're low and rare, and the lower effectiveness that you just mentioned, what would be the rationale for keeping it in our vaccine rollout?
So we've got lots of people who have expressed that they would like to have the opportunity to make their own choice with AstraZeneca. There's a small number of people who, for allergies or other reasons, need to get the AstraZeneca. So for both those reasons, we need to make sure we continue to have AstraZeneca available for people the small number who need it, and the rest who have expressed that they want to have that choice for themselves.
John, do you have a follow-up question?
I do, and this is also for Dr. Strang. You mentioned that we may be facing problems with the supply of Moderna. When could those supply shortages come into play, and how could it affect our rollout?
It's more that the Moderna has been very unstable, and actually we were facing no Moderna for a while, but in the last week we've gotten some good news, a short-term boost in Moderna supply. All our projections of our vaccine coverage are based just on what we expect to get for Pfizer, which that supply would allow us to meet 75% of two-dose coverage by late August into September. If we get additional Moderna vaccine, it'll just speed up our ability to reach those targets. It's just that the Moderna vaccine supply is not reliable at this point.
We'll go to Lindsay Armstrong with All Nova Scotia next. Go ahead, Lindsay.
Thank you. Hi, Premier. You've said that you're not calling it an Atlantic bubble anymore. I'm wondering if you can tell us a little bit more about what that means and how borders will be managed given the potential Canadian travel into New Brunswick and Newfoundland in early July.
Yeah, I don't think you could call it a bubble when New Brunswick and Newfoundland made decisions to move beyond Atlantic for July 1st. But that doesn't mean that we have excessive risk to have Atlantic Canadians come into our province before we start looking at other provinces with higher populations and different epidemiology than we have in the Atlantic region. So again, we'll be cautious as we start to move through our phases. We still have a number of weeks before we get to the Atlantic opening for all four of our provinces. The first one will be PEI has the June 27th date, so we're looking at June 30th. So we're all around the same ballpark, but we will have to make sure that we're looking at their system at their borders as we consider to look at our own border system. And as I said, we're looking at a proof of vaccine strategy beyond what the national government continues to consider. We have testing coming to our airport, keep in mind, on June 14th. So we're adding more and more protections in place, and we'll continue to make sure we have appropriate restrictions here. But we do think that it's still prudent to start with the Atlantic neighbors before we start opening up to all of Canada.
Lindsay, do you have a follow-up question?
Yes, thank you for that. On that same note, I'm wondering if you can tell us a little bit more about the conversations between you and your Atlantic peers and how these sort of differences in decisions are made among our neighbors.
Of course, so I continued to have one-on-one discussions, and when we had the discussion with the group Some premiers have already decided to move ahead regardless of what was happening in the Atlantic region. So I respect that they can make their own decisions within their own province. And again, we were the last province, along with Manitoba, to have the third wave approach our province. So we're not all in the same position. It's fair to say that we're more cautious. PEI is with us as being more cautious with our borders. It's August that they're looking at for the rest of Canada. So we're going to continue to try to be as aligned as possible, but we do have to make sure we're looking out for safety as our #1 priority within our own province.
Next, we'll go to Adrian Blanc with Radio Canada. Go ahead, Adrian.
Thank you. Dr. Strang, do you know what symptom the person who had VIT had?
What I do know is that they met the clinical criteria based on lab and other investigations, as well as the timing between their vaccination and developing their clinical syndrome. I don't have a detailed clinical breakdown for an individual, nor would I disclose that level of detail publicly. But we do know that he met the criteria as a case definition, nationally defined case definition for VIT.
Adrian, do you have a follow-up question?
I do. Mr. Rankin, the fact that Nova Scotia has to be careful right now, what does it mean economically for the province when we see that neighboring province open even more?
Well, we're as I said, we're just finishing our third wave. We lost 2 Nova Scotians today. We need to be mindful of our hospitalization numbers and that we could see another spike if we're not cautious. I do think that the strongest economic policy is strong public health measures. So we've gotten through the third wave in an unprecedented time. What we don't want is another shutdown. So if we continue to be cautious and we follow public health guidelines, we see patios opening today. If we continue on our vaccine rollout as we're expecting to, if Nova Scotians continue to get out and get tested, I got tested today. I encourage others as we open up. It's even more important to make testing as part of your regular routine every week. If we continue to do that, we'll move through these phases with the dates that you see behind us as we estimated, and we'll continue to be fair. But we need to be safe for all Nova Scotians, and that's in the best interest of all of us, including businesses.
Another comment that we had the same discussion a year ago around the reopening, and actually I was on a call this morning with some of my colleagues from the business side of government, and they reminded us that that the 2 provinces that are being the most cautious here, PEI and Nova Scotia, had the best performing economies in 2020.
Next, we'll go to Tim Bousquet with the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. On the AstraZeneca, assuming that most, if not all, of the people like me who got the first dose of AstraZeneca move on to Pfizer or Moderna, will there be some leftover AstraZeneca here in the province, and is there any ability to move that to some jurisdiction that faces a dearth of vaccine right now?
So we're looking at we're anticipating or we're interested to see what the uptake. We have 2,000 doses. The next few weeks will tell us. There have been discussions of the vaccine program around potentially what we might do with any leftover vaccine. The challenge is that vaccine is already deployed out into individual vaccine fridges or freezers in pharmacies. So it's always hard to get all that vaccine back to ensure that it is maintained its cold chain and get it back and for a very small amount. But we'll continue to have discussions with at the national level on that and monitor what the actual uptake of the vaccine is.
Tim, do you have a follow-up question?
I do, and I want to ask you about this fellow who went to Mount Everest and your congratulation of him. This was international non-essential travel during a pandemic, and I'm wondering what kind of message that sends to the rest of Nova Scotians who are avoiding travel to see their grandmothers and such. And should we now just all assume that we can do international travel so long as we think it's safe?
I don't know any of the details about when he might have left the country. He's probably, preparing to go for Everest. You have to be there for quite a period of time. So I don't know any of the details of when he might have left the country.
Next, we'll go to Kyle Shaw with the Coast. Go ahead, Kyle.
Thanks. This is for both Dr. Strang and the Premier about the vaccine rollout. There are some days Nova Scotia is delivering 20,000 injections in a day and even more. But on other days, especially on the weekends, the numbers go way down, well below 10,000 injections per day. So to me, this suggests we have a lot of extra capacity available on the weekends, and we could be vaccinating thousands more people every week if we took advantage of that capacity. You talked earlier, Dr. Strang, about there being no lag when we release appointments, and Nova Scotians seem really keen. So I'm wondering, is there any, with the lockdown lifting, are we planning to ramp up the rollout?
We deliver, it's all based on the amount of vaccine we get. We get weekly allotments of vaccine. We distribute that out. So if we get vaccine today, we break it down and distribute it out to clinics. And that's what we'll be driving our clinics next week. So if we got more vaccine, we're at a place now where we have more capacity to deliver vaccine than we actually are having vaccine supply. But we're not slow or behind in getting vaccine out. We deliver what we have, and if we get more vaccine, we can increase our vaccine supply or our vaccine administration.
Kyle, do you have a follow-up question?
Yeah, I do. Thanks. Just wondering, on our positive testing, are we still sending those positive test samples to Winnipeg to check for variants? And is the lab in Winnipeg, are they able to check for all the latest variants and even new variants to pop up?
Yeah, so we are sending ones based on a clinical picture that we're sending them off for variant testing. We do screening here. We don't yet have the screen, which screening just identifies if they're a variant. It just doesn't tell you what variant it is, and we don't yet have the ability to the screening to include whether it would potentially be a variant of one of the Indian variant. But we batch them; they get sent off. It takes a week to 2 weeks to get the results back. But certainly the analysis at the national lab does include the Indian variant. If there was another variant of interest or concern that came up, one of the first things that happens is that the national labs make sure it has the capacity to be looking for that specific variant.
Next, we'll go to Janet Whitman with Halifax Magazine. Go ahead, Janet.
Hi there. Thanks for taking my questions. Premier Rankin, I know you were asked this earlier this week, but about the mass grave of Indigenous children found in BC. I'm just wondering, you were one of the first to recognize Boat Harbour as an example of environmental racism. Would you call this genocide here, and what are you doing to help facilitate finding out whether there are similar atrocities here?
So you're right, this file is very important to me, and our government closing Boat Harbour was something that was long overdue, that past governments did not keep their commitment to Pictou Landing First Nations. I'm very proud of Premier Steve McNeil for having the courage to see that through, and we have a lot more work to do. So specific to this finding, it's terrible. I did contact Chief Sack, the chief for the area where we had the former residential school, just to let him know that we'll continue to be a partner. I understand that since 2019 there's been some surveying led by Parks Canada, and we're a partner along with KMKNO in the province to continue that search, and whatever we'll continue to be able to provide is in terms of support. We'll do that, and we'll continue to have discussions. I've also called Premier Horgan in British Columbia to learn how that was funded and to see if there's anything that we can emulate over here to ensure that we're continuing on the journey of reconciliation.
Janet, do you have a follow-up question?
Yeah, that's great. Thank you. And then just also wondering, I mean, certainly racism is alive and well here, and if you just look at the fact that fishers in the Indigenous community don't feel safe going out in their boats, what more can be done there as well?
Well, I expect all Nova Scotians to be treated with respect, and safety needs to be maintained at our wharfs across all of the whole province. So we have an obligation, the province does, to ensure that we uphold public safety, and that's what we'll continue to do throughout the year. And obviously there's some challenges with the definition of moderate livelihood that the federal government is working through.
Next, we'll go to Pat Healy with the Laker. Go ahead, Pat.
Thank you. Good afternoon. This question's for Dr. Strang. With schools returning on Thursday for the remainder of Nova Scotia, students will be indoors all day in groups of 25 to 30 without social distancing. Why then are youth sports not resuming at full capacity, especially since most will be outdoors for significantly less time and less people?
So, Pat, thanks for the question. It's a matter of priorities. We've said from the very beginning that one of our core priorities throughout our pandemic response was to have, wherever possible and safe, have children and youth in school. To do that means that we have to continue to have, for a little while longer, restrictions on other things which are more optional and not as much of a priority. So, because the way we keep our schools safe is to make sure that our communities have low levels of virus and our communities are safe. So we are going to open up in the coming phases opportunities for arts and culture and sports for all ages. But the first priority is to have children and youth in school learning, and then we'll address some of the other ones which are not as much of a priority over time.
Pat, do you have a follow-up question?
Yes, I do. Also for Dr. Strang. Do you have any more details on what the testing at the airport will look like?
We'll have some of that in the days ahead. We're still working out some of those details about whether it's testing right at the airport or people giving a take-home test. We're working out some of that, and again, the briefings in the next few days will give more details as we start to roll that out.
Next, we'll go to Jonathan McGinnis with CTV. Go ahead, Jonathan.
Hi, thank you. This question is for Dr. Strang. Dr. Strang, with schools resuming tomorrow in Halifax and Cape Breton, do you see there being a benefit, or will there be testing in those facilities?
Yeah, so we continue to work with education on all their operational issues that they have to deal with, but certainly looking at how we incorporate testing as part of that reopening of schools. Right now, the focus is in the Halifax area, which has had the greatest level of virus activity.
Jonathan, do you have a follow-up question?
Yeah, this one's probably for the Premier. Premier, will parents be able to choose to keep their children at home if they're not comfortable sending them because of COVID or even because of the warm weather we're experiencing, and the kids are going to have to be wearing masks all day? Will they have that option to continue keeping their kids home?
So kids should be in school. The Department of Education has worked really hard to have the right protocols in place, the right safety measures, the personal protective equipment is there. Masks can be worn without any challenges to weather. So I do expect kids to be in school, and parents should encourage kids to learn in school. But of course, if there's extenuating circumstances and there's concerns raised, that I think that it's reasonable that schools be flexible in dealing with those one-on-one circumstances that could arise.
And that's all the time we have for questions today. Go ahead, Premier.
Thanks. I've been following on social media the wonderful pictures of children returning from school. Look at those smiling faces, such joy and happiness. To all of our students and teachers and principals, we hope you had a great day. To those returning tomorrow, we hope it brings you happiness. To our businesses that reopen to the public today, I hope you've been busy and you've had a positive day greeting customers. To those that had to innovate, to operate outside, thank you for respecting the restrictions that we have in place right now. As we move through phases, we're pushing our vaccine program. And as long as we have supply, we are putting needles in arms. Currently, as I said, 71% of our population either has their first dose or is booked to get one. And second doses are on the way. It's very helpful and strengthens our immunity as we open up our economy in each phase. and it helps us design a modified quarantine plan. We are close to finding a level of normal in the midst of living with COVID. We have to continue to follow the restrictions and all the protocols. We've been dealing with COVID for 15 months now, and you have been remarkable through it all. But we have to continue to remind ourselves that the variants are still very serious, and you oftentimes need 2 doses to ensure better protection. We're on track to get everyone their first vaccine within weeks, and starting our second doses very soon. We don't want to open up too much too soon. The phased approach may not work for everyone. It may not be the fastest, but in our view, it is the safest.